Stroke is a very debilitating condition, a non-communicable disease that affects majorly the brain, but the impact can go on to affect the entire body. Now, the predisposing factors are from conditions like hypertension and obesity, diabetes, and guess what? 80% of Uganda's population that has hypertension do not actually know that they have the condition. And this is what health experts are worried about. And to raise awareness and to change this, Chibuli SS thinks that it should be done from the early ages of our young ones. This is an aerobics session at Chibuli Secondary School. Today's activities are crowning a week's awareness campaign on stroke. If you're wondering why this is so dear to them, here is why.
We chose to have the stroke awareness week because of how bad stroke has struck us, how it has affected us. So, for example, in 2023, we lost a teacher. As I've said, I'm a biology teacher, and this was a colleague in the department, Mr. Sylvia Moses. He died because of stroke. That was 2023. The following year, 2024, we lost a student. And bad enough, the other one was a colleague in the same department. Now this one was a student that I taught in the same class. It was called Chinene Yusuf. I was teaching him in the class and lost to him. But also, as you have seen here, we've had about 6 teachers suffering from stroke. Our deputy teacher suffered from stroke for about 6 months, but good enough was able to recover. We have Mr. Busurwa, he is completely disabled. We have others that have been affected by stroke. So we have lost lives in others, and also we have had such a devastating effect have become lame.
Majid Busulwa teaches economics here. He is one of the more than 5 people that have been affected by stroke at the school. He just resumed his teaching duties, but still recovering from the effects of the stroke.
I was at home. I was just trying to transplant my certain organ. Then I developed this dizziness, and I knocked my head on the wall. From there, I went to the tap to pick to get water to water the other orange which I was planting, and they found me just falling there. I could stand and fall.
Busulwa explains that he did not have the common predisposing factors like high blood pressure or diabetes by the time he suffered the disabling ailment.
My problem is cholesterol. The problem was cholesterol and maybe not getting enough rest. People need to rest, but people that workaholic, I say it in your monitor. People are used to work so much, not getting enough rest. If it is time for sleeping, people need to sleep. But you see people, they go to bed and they go on social media. So people need to sleep.
Science explains that stroke can happen when a blood vessel bursts within the brain and bleeds within its surrounding tissue, commonly known as a hemorrhagic stroke, or the ischemic stroke caused by a blockage, making up about 87% of strokes.
Stroke is entirely a brain condition. It is usually happens when there is a problem with the blood flow to some of the brain tissues. It could be partial or complete loss of blood flow to a certain part of the brain, or it could be as a result of blood leakage into the brain cells for any reason. And the symptoms and signs we may get will depend on which part of the brain that has been affected and maybe the severity. Okay. Yes, please.
Busulwa says he was lucky to have received quick medical attention after his family members noticed an unusual body changes.
I'm doing it because the brain was not affected. I do the discussion, the marking, but originally, I used to move to different schools. So now that is where and apart from teaching, I do other some work, like electrical wiring. But now I can't do it because of the sun. It has not yet recovered.
According to health experts, the symptoms of stroke include trouble speaking and understanding what others are saying, numbness, weakness or paralysis in the face, arm or leg, problems seeing in one or both eyes, headache, and trouble walking. and the best intervention is to seek medical care immediately.
The identifiable risk factors have always remained hypertension, high blood pressure, those people living with diabetes, those people with obesity, a high body mass index, high BMI. Those are some of the modifiable risk factors. Modifiable as in there's something you can do about them. There are those factors that actually we have nothing to do about them. Age is one of them. As we age, you realize many people have gotten a stroke when they reach their 60s, 70s and above. They may not have much to do about it. Then there is family history. If your close relatives have suffered a stroke, you are actually at a high risk that you may suffer it. Then there is a race. We have it on record that the Afro-American races, we are at high risk of getting these stroke cases. We may not have exact causes, as would we say. That's why we stress that there are risk factors. It means some people may have similar factors, but actually they are not getting the stroke. So that's why we say there are risk factors. 5.9% of people dying out of a stroke. That's a big number that is increasing. In the past, it wasn't our case. We are suffering from malaria, diarrhea, and other communicable diseases, but now the non-communicable diseases are taking over.
Recent reports have critiqued schools regarding feeding and having enough play areas and time for learners. Fortunately for Chibuli, they have the fields to support sports, but they are taking even further interventions to change the diet.
Specifically, the portion increases the risk of stroke because sugars accumulate in the body because it is the carbohydrate. But now as a school, we have introduced what we call a green plate day. Every week, we are now introducing a green plate day, whereby on that day, these learners are able to get a quarter of their plate being greens. Even last week we had, we hope to ensure that we have it every other. Then also, as you have seen, as you can actually see here, we are now putting more fruits on the school canteen for learners for them to buy them. So we're teaching them so that instead of buying a Rolex, maybe you can buy an apple.
I think it's time that school administrators and proprietors bring maybe nutritionists on board to see how we can curb this. Because some of these things we see in the late age or when we grow up, most of the problems could have begun at a younger age.
For the students, this is an opportunity to learn more about non-communicable diseases that are now listed as the top causes of death and disability globally.
What I've understood from this week and the stroke awareness is stroke can attack anyone at any age and at any time. And most of the things that cause stroke, eating oily things. When those oily things accumulate, when the fats of the oily things accumulate in your blood vessels, they're going to stop blood flow to the brain.
I intend to talk about stroke elsewhere. The moment I'm out of school, I intend to go and move on the word, and not only just spread the word stroke, but rather give all the people the knowledge that I have got, that I have been able to get this week.
Stroke can, however, be prevented, and the World Health Organization has listed regular physical activity, having a diet less of fatty and oily foods, reduction in alcohol consumption, keeping a healthy weight, managing cholesterol levels, treating heart disease, and taking your medicine as some of the most effective ways. Walter Mwesigye, NTV.